Hello, I'm Ron Mastrogiuliani, CEO of HealthView Services. I'm delighted to share some of the findings of our 2017 Retirement Healthcare Cost Data Report. In our third annual report, we outline our benchmark projections and the percentage of Social Security benefits required to cover healthcare expenses. We break down what's driving costs higher and what Americans can do to plan for and potentially reduce the burden of healthcare in retirement. Let me take a minute to highlight how we develop our projections. Forecasts are based on 70 million health cases, government, economic, and longevity data. We then use an actuarial and medically reviewed approach to calculate costs for the various components of retirement health care. And they include Medicare premiums, supplemental insurance, and all out-of-pocket costs. Results which are incorporated in our retirement planning tools are utilized by leading financial institutions, allowing them to provide data to clients on an individual basis by age, gender, health condition, location, and time to retirement. The bottom line is that costs are continuing to rise. We project healthcare inflation to grow at an average of approximately 5.5% for the foreseeable future. This is close to 3 times the average U.S. inflation rate of the last 4 years and more than double the trustees' projected annual Social Security cost of living adjustments of 2.6%. In the context of investments, compounding works to our advantage, but when it comes to healthcare costs, it works against us. Lifetime healthcare premiums for Medicare Parts B, D, and supplemental insurance for a healthy 65-year-old couple retiring this year is estimated to exceed $320,000 in today's dollars. When we add deductibles, copays, hearing, vision, dental, that total exceeds $400,000. These numbers assume the combined income at retirement of less than $170,000 a year, which is when Medicare surcharges kick in. The differential between healthcare inflation and Social Security COLAs mean that a growing portion of Social Security benefits will be required to address healthcare. Our Retirement Healthcare Cost Index shows that a 66-year-old couple will need 59% of their Social Security benefits to cover total healthcare costs. A 55-year-old couple will need approximately 92%, and a 45-year-old couple will need 122% of their Social Security benefits to cover health care. These numbers are big, but as the report details, for those already saving in a retirement plan, putting a modest savings aside for health care will be sufficient to meet at least a portion of those future needs. The growing number of retirees who will be impacted by Medicare surcharges also have the ability to manage or reduce them by talking to their advisor about products that do not count towards MAGI, investing in HSAs, a Roth 401k, a Roth, or specific insurance products can save thousands of dollars. The report highlights one of the most powerful ways to reduce cost. That is by applying lifestyle changes that help manage various health conditions. These steps can reduce annual healthcare expenses for a 50-year-old diagnosed with type 2 diabetes by an average of $5,000 a year pre-retirement. That average $5,000 invested at a 6% return would generate $120,000 in additional retirement savings. One of the lessons of this year's report is what we do as individuals really matters when it comes to retirement health care. I encourage you to read this report by visiting hvsfinancial.com.